President Obama has made health care a top priority and hopes to reach some kind of reform this year. After speaking with doctors at the annual meeting of the American Medical Association, local residents and medical physicians have their opinions on what Obama calls the ailing health care system. Now, ABC 27's Marco Villarreal gets reaction.
It's hard not to have an opinion on health care, seeing as we all need it sooner or later.
And I'm hoping for one system that will cover everyone.
I think if we don't make some changes, that it's going to be terrible because we're just wasting too much money.
Monday, the president called for reform in front of the American Medical Association, saying it could ruin the country financially.
If we do not fix our health care system, America may go the way of GM. Paying more, getting less, and going broke.
But how to change and what seems to be the snag. Dr. Sunithya Strong practices private medicine in Tallahassee and believes every American should have access to medical treatment. But the politicians will have to fight one of the biggest battles for health care reform.
Probably the most controversial issue is a government-run portion of health care.
And although Dr. Strong doesn't know enough to comment on whether government involvement is a good thing, she does say dealing with fewer insurance companies would help, and so would less stress about medical malpractice suits.
It makes for a really adversarial situation, and we feel that we have to practice defensive medicine.
Now, one thing that physicians do agree with what President Obama said is the fact that they would rather spend more time with patients than with paper.
For every hour that I spend seeing patients, I spend 15 to 20 minutes taking care of paperwork.
And while President Obama hopes to accomplish health care reform this year, people aren't holding their breath.
I wish it could be fixed in a year.
In Tallahassee, Marco Villarreal, ABC 27 HD.
Other local medical experts also agreed that something must be done, but say again the issue is how to get it done. $3 billion